Thanks for staying with us. We know that so many of you still have questions when it comes to COVID-19 and vaccines and, of course, getting the shots. And we're here to help.
And with this resurgence, those questions keep coming in. With You Ask, We Answer. We're bringing those questions right to the medical experts for the answers that you're looking for. Dr. Ulysses Wu is an infectious disease specialist with Hartford HealthCare. Dr. Wu, thanks for joining us here on the Fox 61 News at 4.
Happy to be here again.
So one of the questions that we're getting a lot of talk lately about kids and these COVID-19 vaccines, parents eager to know, when is the vaccine going to be ready for children who are not yet eligible for that shot, especially with back to school coming?
Yeah, I totally understand the anxiety revolving around vaccines in children and the wait. It's tough for people, especially those who are 11 and they're right on the cusp of getting the vaccine. But the reality is that the FDA and the CDC, they want to make sure that they pivot in the right way, and they want to make sure they do their due diligence. You obviously hear a lot of vaccine hesitation on the other side because everything's quote unquote moving too fast. And so they are looking at the data, they are looking at the studies. The hope is that something will happen by the end of the year, but I suspect that it'll be early 2022 before many of these are approved.
So I'm a parent watching the three of us right now, and I'm sending my kid back to school in a couple weeks. He's not eligible yet for a vaccine. She's not eligible. What can I do to make sure that my child is safe while they're in school?
Yeah, so I talk about the concept of bubbles, and what you want to do is you want to make your own protective bubble as big as possible to protect your child. So it starts at home. People need to get vaccinated. They need to use masking in certain situations so they don't get the illness and pass it on to their child. And then when they go to school, obviously that bubble shrinks and your protection shrinks as well. And so the other option at that point is two things. Number one, masking is the next level of protection, and then social distancing. Or you can consider it in the fact of, in the same vein of make sure that they don't get in social situations where they may put themselves in jeopardy. Those are the really 2 or 3 best ways to protect them.
Dr. Wu, the CDC just put down new evidence supporting pregnant women getting the COVID-19 vaccine. So why is it so important for moms-to-be to get their shot?
Oh, I mean, it's so important, and it's really it's the concept of eating for two, right? And you're protecting two people at this point if they're about to deliver. And what's going to happen is that we've known that with pregnancy that they are at higher risk for complications, and so it is very important that they protect themselves. And so I'm glad that they approved that. We've always known this all along at this point, but we're happy that that they approved it because we really want them to get vaccinated and not have complications.
Does that help the baby once the baby's born?
It's a great question, and so that's what I meant for the eating for two. And so what happens when the baby is born? So they've detected antibodies that have been passed through cord blood, and it's also been passed through breastfeeding as well. So there may be some passive transfer of immunization or antibodies to protect the baby as well.
All right, interesting. Dr. Wu, we appreciate your expertise.
Thank you for having me.
All right, moving on here.